Hey y'all, it's Nurse Key and welcome back to the new Nurse Boot Camp. So now we're going to talk about medication administration. Now I'm not going to go into like the actual basics of medication administration. You've already learned that for nursing school. Let's put the pieces together and be effective in medication administration. So when you actually become a nurse, you should have like a good grasp on the medication in general. And if you don't, or you're not familiar with a certain medication name or the principles of things or why it's used, then look it up. That's okay. I want to go into how to go from reviewing your medications, pulling them from the Pyxis or the medication storage room, and then actually giving them to a patient. So there are a few principles that you need to know to just have like time effectiveness and actually be safe in your administration for your patient. All right, so first off, you're going to review your MAR. Your MAR is like where the list of medication is. Okay, so first you're going to look at the MAR. This is where the list of medications will be. It'll say each medication, which is scheduled at the time frame that you're anticipating, and sometimes it'll say why. Of course, it'll say the dosage, the route. It will say the It also, most MARs actually have a button where you can actually look up the medication information of like different adverse effects, how to give it, maybe if it has to be reconstituted. There are a few major things to even look at when you're reviewing the MAR. Let's say you have an oral medication, but the patient is NPO and they don't have a PEG tube or something, another way of getting them the medicine. You need to clarify this with the physician. Or they're NPO, they have a PEG tube, but it does not say that the route of these medications can go through the PEG tube. That's something else to clarify with the physician and the pharmacy. So these are things to know. You would know by assessing your patient, reviewing the MAR, and making sure everything lines up really before you get to Pyxis, because it just saves time. And then also, too, you'll need to know if there is medication that is housed in your traditional medication storage place, whether that if you're in a skilled nursing facility, is that your medication cart, or if you're in the hospital, is that in your Pyxis or your Omnicell room, or is it on stock medication? Some medications are generally have to be sent down by the pharmacy, or it's their home medication, or yeah, those are usually the two. So it's good to look beforehand so you can actually request it from the pharmacy, or you may have to order it if you're in a skilled facility and it's actually not on file. You may have to order it or get a pin for them to pull it. So prepare beforehand. All right, so now you prepared, you reviewed your medication.